guys, this isn't even in the course, but I want to sheepishly share another pain point from the other perspective that I've learned through this topic specifically is also on the doctor side, we create pain. So, or we can, and you do this totally innocently. Here's a scenario. This happened last week. We had a doctor's meeting. We talked about it. My staff don't like it when I do this. You get a patient in, they're not actually set for myopia control. They're not set for Ortho-K fit. They book themselves as an eye exam. Turns out all they really need is Ortho-K. So you do your best, fit them on the spot. You want to close the deal, get them, their butt in the chair, get them committed to coming back for their Ortho-K. I mean, I can do it in the time that I have, no problem. And don't ever get them to sign consent forms on the way out because they didn't have a proper introduction to the clinic. The staff did not give their little spiel to them ahead of time to talk about pricing. I send them on their way with this charge. And, sometimes if I talk to them about it, they're fine with the money itself, but you bet that half the time if I do that, I'm not getting a consent form signed. Some of those details are missed by me in the exam room because I'm off to the next patient. Staff hate when you do that. It creates a lot of stress for the front desk and for the staff when patients are not clear and have proper consent forms signed. So what we do on average now is my new fresh leaf chapter that I'm going to attempt is, you can't do it all. Sometimes you have to bring people back and schedule them for a time that then they can have the proper infrastructure. So it's, not black and white. I will never promise that I'll never do that ever again. But, on average, just remembering to get those important administrative tasks done is just a great way to avoid the pain on both sides. On all three sides, actually, patient pain, staff pain, and then my pain, doctor pain.